Rahim. Hello to all my colleagues and to all my fans and to all my friends and all my colleagues and students. Today I will talk about Professor Dr. Tarek Ali. Today I will talk about an important issue in medical practice, which is the essence of medicine. The essence of medicine اللي هو جوهر الطب, or we can say the essence of the art of medicine or the essence of clinical practice. And in fact, the essence of medicine is the medical ethics, which should be always considered at the forefront of the healthcare delivery. And the four main pillars of what we call the essence of the art of medicine or the essence of medical practice are: number one, beneficence. And by beneficence is that giving good care to the patient. To give a good care to the patient, to give a good care and good considerations of your job as a healthcare provider, who is the physician or the surgeon, the practicing doctor. And this is number one, by putting in mind that the main role of medical practice is prevention. This is number one. And then number two, if you can't prevent, then treatment, number two. Because as we say, prevention is more important than cure. So to prevent the problems is the essential role of the medical practitioners or of the healthcare system in general in any country. Prevention. For example, prevention of infectious diseases, prevention of pandemics, prevention of communicable diseases, whether the infectious diseases or non-infectious diseases. So prevention is the most important task of the healthcare profession. So to be beneficial is the most important and number one pillar of medical ethics, in order to give good care to your patient, in order to improve the patient well-being, and to improve the quality of medical practice by giving good care to your patient, who is the healthcare consumer. So the healthcare provider, who is the physician, gives a good care to the healthcare consumer, who is the patient. This is beneficence. Number two, pillar and core of clinical practice or of the art of medical practice is what we call the to consider not to being harmful to your patient. That is, do no harm to your patient, and this is maleficence. So the maleficence is do no harm. That is, you have not to cause any problems to your patient, because your role as a healthcare provider is to prevent or to decrease morbidity and mortality. That is, to decrease the possible adverse effects of the treatments for a specific disease, and to prevent the sequelae and complications of the disease or of the treatments given to that disease. And number two, to prevent or minimize mortality, that is the death rate, or the preventing the life-threatening complications which might ultimately end into death, regardless of considering, of course, the poor prognostic signs versus the bad outcome of the patient or the negligence of the physician or of the healthcare provider, which is negligence in clinical practice causing medical errors. So do no harm is number two, to consider as the second pillar in medical practice, or as the second pillar of the medical ethics. Do no harm. And doing no harm is more important than to be beneficial to your patients or giving benefits to your patient or improving the patient's well-being. So this is number two, what we call the maleficence. Do no harm. That's why we always say that, and this is one of the aims of medical practice in general, that the physician or the surgeon should be safe in clinical practice. Number two is, after being beneficial, that is trying to be effective, trying to like giving effective medicines, But the most important before being effective medicine is that the medicine should not be harmful. It might be effective but harmful. If it is harmful, avoiding these possible side effects or the adverse effects of your therapeutic modality, whether a medication or a medical procedure or a surgical procedure, try to consider its harmful effects on your patients before considering that it has beneficial effects on your patient. And this is what we call do no harm. So the physician or the surgeon should be, number one, safe in practice, and this is number two, before being effective in practice. Safety has a predominant consideration before effectiveness or before being effective healthcare provider, effective surgeon, or effective physician. So do no harm is very important. Being safe in practice is very important. From the ethical point of view, from the medico-legal points of view also. So this is number two pillar. Try to be safe in practice. Do no harm. Number three is what we call justice in clinical practice, which is the fair distribution of all opportunities, of all kinds of treatments, and all types of therapeutic modalities to your patients according to or putting into consideration the healthcare or the health problem of every individual patient, whether your therapeutic modality will be surgery, will be radiation, will be medication, will be whatever, and which type of medication, regular medication or immunotherapy or endocrine therapy or hormonal therapy or biologic or whatever. So here the fair distribution of all kinds of treatments is very important. Fair distribution of resources, of medical resources to your patients, fair distribution of opportunities in the clinical management or in the management to all categories of patients in the society. So this is what we call justice in practice, is number three pillar of medical ethics for proper medical practice or for proper healthy clinical environment. This is justice in distribution or fair distribution. Number four is what we call autonomy, which is considering the patient's role or the putting the patient at the center of your decision. And this is what you, or in other words, we say the informed decision of the patient, or the active role of the patient in the final clinical decision regarding the treatment, after educating the patient and after giving the patient the appropriate information regarding diagnosis and treatment of his medical problem according to each individual patient separately. And this is what we call the patient-centered clinical approach in healthcare delivery or in dispensing the healthcare services to your patients, which should be considered by the healthcare system in any city or in any country or in any society or community. So this is autonomy. That is the patient's choice. The patient's choice. In order to get at the end what we call the written informed decisions by your patient in his or her final clinical management. This is autonomy. So beneficence, maleficence or maleficence, autonomy and justice are the four main pillars of adequate clinical practice, and which should be considered and should be understood by every healthcare provider. Try not to be injurious to your patient, whether intentionally or non-intentionally. That's why the healthcare provider, whether a physician or a surgeon or radiologist or whatever, giving healthcare service or provide healthcare service and to the healthcare consumers in the society, should understand it's not only enough to know, but to understand also the possible hazards of the diagnostic decision or the diagnostic approach which is needed for the diagnosis of every individual patient regarding the laboratory or the pathology or the endoscopy or interventional radiology or whatever diagnostic procedure, and also considering the possible or the potential side effects and the adverse effects of every therapeutic modality chosen for the management of your patient or for the treatment of your patient, whether a medication or a surgical procedure or irradiation or endoscopic procedure or any of the procedures which we need for the therapeutic modalities which we need for the management of the patient. This is the role of the medical practitioner, to understand the essence. This is the essence of medicine. This is the essence of the art of medicine. This is the essence of the medical practice, to have a proper, wise clinical environment. This is my remarks today to all my students and the healthcare system personnel in general, in order to improve our medical profession at the end, which is our final destination. Thank you so much, and my best wishes to all of you, and my regards to all my followers and all my listeners, and to all my students and colleagues. Professor Dr. Tarek Ali.